Welcome everyone to the Settle In Live session. My name is Chiamaka Gali, and I'm the Virtual Events Manager at Settle In. We are partnering with Switchboard for today's live event to help you understand what to expect during a counseling session. Switchboard is a project implemented by the International Rescue Committee, and its mission is to support professionals and organizations who work with refugees. When commenting during this live session, please remember not to share any personal or confidential information as we are public-facing. Overview. In last week's session, we gave an overview of mental health care, signs you may need more support, and different types of providers. That recording can be accessed on the Settle In Facebook page and Settle In YouTube page. In today's session, we will give a general overview of what to expect when seeking professional emotional support, preparing for your first appointment, and continuing care. If you have questions, please add them as comments to this video or directly message us. Seeking support is normal. You may feel stressed, worried, sad, or overwhelmed during your resettlement journey or in daily life. It's normal to experience these feelings and to seek professional support if you need help. In the United States, many people seek professional emotional support when they need extra help. Talking to a professional can provide you with the tools you need to navigate through these emotions and find ways to feel better. Remember, you're not alone, and it's okay to ask for help when you need it. If you're not sure whether you might need professional emotional support, review our previous live events to learn more. Types of support. It can be challenging to know when you need support, especially if you're focusing on your basic needs and safety. In the United States, professional support is available when you need more help. This support can include meeting with a mental health provider, attending a support group, or receiving medication from a doctor. It can be overwhelming to know where to start because there are many forms of support. To learn more about types of professional support, please rewatch last week's video on our Settle In Facebook page or Settle In YouTube page. It's important to know that providers and interpreters must keep what you share private unless they're concerned you might hurt yourself or someone else. This means that your provider and interpreter will not tell your family, friends, or community about your thoughts, feelings, or conversations. Choosing an emotional support provider. Choosing a provider is a personal decision. Finding a provider that works well for your concerns and your schedule may take time. Before scheduling an appointment with a professional support provider, consider your personal, financial, and treatment needs. As you are looking for a provider, you should consider health insurance coverage. Certain providers accept health insurance, and some are considered out of network. You should ask if the provider, organization, or support group accepts your health insurance and if there are any additional fees or payments. You can also ask if the provider can bill your insurance directly or if you will need to pay the provider and then submit a reimbursement request to your insurance. Accessibility. As a patient, you have the right to interpretation in your preferred language at no cost from any health organization that receives federal money. Tell the hospital or clinic staff that you need an interpreter when you make the appointment or arrive for emergency care. You should also find out where the provider is located, what hours are available for your treatment, how long you might wait to receive services, and if the provider will see you in an emergency. For example, consider whether the provider is in a clinic, community mental health center, or private practice. You should also consider if the session is in person, over the phone, or on an online video call. Treatment. Ask whether the provider has had experience supporting your type of concerns. You can also ask if your provider has a similar cultural background or experience working with newcomers. Some providers support specific people like children or families. Some providers support different emotions like stress or sadness. Licenses and professional training. Each state in the United States has requirements to make sure providers are qualified to provide specialized services. Only providers with proper training can receive a license and provide mental health support. If you're unsure if your provider is qualified, you can ask for proof of their license or professional training. Remember that choosing a provider is a very personal matter. Finding a provider you trust and feel comfortable with is important. It might take time finding the right provider for you. What to expect in a counseling session. It might feel strange to talk about your feelings with someone who isn't your family or community, or from your cultural background. However, talking with a provider can help you process strong feelings or help you navigate challenges. During counseling, you might speak one-on-one with your provider about what's bothering you. You might do different activities like drawing or learning ways to relax. The goal is to help you feel better and teach you coping skills to navigate challenges. Everything you talk about in counseling is private, except if you or someone else is in danger. That means it's just between you and the provider. Counseling sessions are usually about 50 minutes long. You might go once a week or once a month, and you'll see the same provider each time. If your provider doesn't speak your language, they will provide you with an interpreter. The number of sessions you can have will vary. It could be just 4 sessions, or it might stretch out over a few months or even years, depending on what you need. And remember, you can decide to stop attending sessions or change providers whenever you want. Finally, counseling isn't just for adults. It's for everyone, no matter how old or young you are. There's also couples counseling or family counseling if you need it. It's important to remember that the care and support you receive depend on how honest and open you are with your provider. The reason providers ask questions about your personal or health history, especially during first visits, is to establish patterns, write down important information, and give a diagnosis based on a combination of their expertise and the information you provide. Honesty with your provider ensures you get the best and most appropriate care possible. Differences between case managers and counselors. Case managers and counselors can both help you, but they typically do different things. Mental health providers like counselors and therapists listen to your feelings, help you process your emotions, and help you build coping skills. Mental health providers usually won't give direct advice or help you find resources or benefits. Your case manager might help you find resources, apply for benefits or services, or set up appointments. Your case manager can help connect you with emotional support services, but they typically don't provide these services for you. Your first session. Once you've found a provider you are comfortable with, you can schedule your first appointment. Your provider will have different forms for you to complete and sign before your first session and might collect information about why you're seeking mental health care. For example, before your session, your provider might ask you to sign a consent form. This form tells you about the details of treatment and your rights and responsibilities as a client. Because these forms are often written in English with complex language, your provider may go over the form with you verbally. If there's anything in the consent form you don't understand or are uncomfortable with, don't be afraid to ask questions. Your provider is there to help you, and they want to make sure you feel comfortable and confident about finding emotional support. If your sessions are virtual, you may have additional forms to complete. Your provider might ask you about where you live. Providers can only give care in the state where they hold a license. So if you're not in one of those states, you cannot receive care from them. After you sign the required forms, your provider might ask questions to understand your thoughts, feelings, or behaviors and what you want help with. They might also ask about your personal and family history. You might also be required to complete some mental health assessments before your first session. The results will give your provider an idea of your emotional health and how you're coping. If a question is too difficult to answer, let your provider know. At the end of your session, the provider will inform you of the next steps, including follow-up appointments or any referrals. After your first session, you may feel many things. It's good to set aside time to reflect on your session and make sure you feel empowered about the next steps. For tips on managing emotional health and wellness, see our previous live event. Continuing care. It may take several sessions before you feel comfortable with your provider. You can choose a different provider if you attend a few sessions and don't feel comfortable with the provider or feel a lack of support. It's important to know that feeling uneasy during therapy doesn't mean your provider isn't right for you. Once you've found a provider that you can continue working with, make sure that you go to your appointments on time. Take any prescribed medications and follow up with specialized care if needed. You can ask your provider for help if you have questions or concerns. Your provider will regularly talk to you about your emotional wellness and goals. You can also bring up these topics with your provider whenever you need to. It's important to remember that the amount of time it takes to feel better or heal can vary. Some things might get better in a few months, while others might take longer to process. Mental Health Care Live Event Series. Today's session covered what to expect in the mental health care session. Last week's session covered mental health, different types of providers and treatments in the United States, and when to find support. If you want to access a recording for this session, it will be posted to our Facebook and YouTube pages soon after it is completed. You can also find the recording for part 1 on our YouTube channel or Facebook page. For more information on patients' rights and responsibilities, how to get interpretation, and more health-related topics, please check out the Help Center. Thank you. I'd like to thank you for joining us for the Settle In Live event. We covered a lot of information. You can return to this recording after the event to review the information again. We also encourage you to follow the Settle In Facebook page for the latest information you need to know as you adjust to your new life in the United States.